In our office we're using Biomed. Biomed, this is a special Japanese mattress, and this is they have the healing ability to manufacture negative ions in infrared, so far infrared. So far infrared, this is close to our sun. We know the sun manufacture a lot of infrared, and this is very good for our body, especially very good for our immune system. Negative ions, make example, the people knows how easy to breathe after rain in the park or in the forest. Why? Because they have a lot of negative ions, and this is negative ions open passages and easy to breathe and make more oxygen in the body. Another way to improve our immune system, a little bit strange for you. It's called colon hydrotherapy. Colon hydrotherapy. Why I'm talking this way? The Chinese, many years ago, they put colon and the lung in one origin. So at that time, they knew connection between the health of the colon and health of the lung. So, and this is, they didn't know about what we know now. But what we know now, our health depends on the very important things. Our friendly, our beneficial bacteria in our gastrointestinal tract, and especially in the in the colon. In the colon. So the people consider if they will take the just probiotic, this is a very good. It's not such a simple things. So if you will have if you will use antibiotics, if you will drink a lot of alcohol, if you eat the processed food, fluoride water, stress, different kind of things, we have diminish our level of our good bacteria, and the good bacteria responsible for our immune system. Can you imagine 70% of our immune cells in the gastrointestinal tract? So doing the colon hydrotherapy and taking probiotic by mouth can improve the level of the good bacteria and improve immune system. I want to share with you my secret weapon to fighting with any pulmonary problems. So let's go to history. The George Gregory, medical doctor, and he is a professor of the UCSF. Many years ago, he published the book. It's called Pediatric Anesthesia. So at that time, I was a young doctor of intensive care and anesthesiology. So this book will really give me idea. What does it mean? What he put the Gregory, Dr. Gregory put in this book. He was a pediatrician anesthesiologist, pediatric anesthesiologist. So many in that time, some premature born babies, they have a very weak lung. So the lung and they doesn't have pulmonary surfactant, and they have the tissue and the alveoli was deflated. So usually the treatment before the doctor Gregory, it was the intubation, and they put and breathing. Professor Gregory developed another technique. They put some special device and mask to make the positive pressure. So the baby need to be exhale through the positive pressure and make a resistance to the exhale. It make the resistance in the exhale. They make the alveoli open. When alveoli open, the surfactant, it manufactures surfactant and have a better the gas exchange. It was time I was a young, very conservative, but a doctor, but I was curious, and this is make me think something in it, and this is really something in it. So I try to think about how to make it simple, and I've developed the very simple device that everybody can do it at home. Look at this. simple. It's simple, but it has very good physiological backup in it. What you need? You need the bottle, you need tubes, and you need the water, and you need the bottle. That's all. It's very cheap. It's very simple. Don't focus on the bottle. What kind of bottle? Big and that, it doesn't matter. Don't focus on the tube. It can be a plastic tube and rubber tube, a metallic tube, or you can do it something to fix it, throw. It doesn't matter. The matter is the level of the water column. The water column. To make the story short and empirically, I developed the easy way to make the column by using this distance, the distance between the thumb and the index fingers. So different kind of people have different kind of distance, and this is I put the water in this, like that. So during this stuff, they can really improve the gas exchange, improve the more oxygen and improve more oxygen in the body, and this is they can really, if you will do this, they can really improve the microcirculation in the lung. What does it mean, improve microcirculation in the lung? I told you, we have a biology law. The more vesicles, the more lung tissue we use, the more the blood go to this tissue. Go to the tissue. The more blood go to the tissue, it means more oxygen go to the in our body. It means with blood more immune cells go to our lung to fight with virus and another infection, and this is it's mean the better manufacture of the pulmonary surfactant. So this is a simple device of what I developed. I use it 40 years. I use it in acute and chronic situation. I use it in the kids and very elderly. I use it in the infection and different kind of things. I have the intensive care unit in psych hospital, and we have the very a lot of people with pneumonia. So I came in the morning and we have this device, and the all 10 people sitting and blow up the tube. How often you have to do? Every hour you need to do 10 breathing. Or I advise my people to do it as minimum 20 minutes a day. What does it mean? 1 minute, 3 minutes, 5 minutes, well, it will be altogether will be 20 minutes per day, 20 minutes per day. Deeply in my mind, and who knows, maybe I'm really right, this is about the ventilators. Okay, maybe 1,000 ventilators will be not using after this pandemic. Even now, the many doctors in intensive care try to discuss another ways how to help the people with acute respiratory distress. We're talking about pneumonia, the viral pneumonia. So and they try to use another technique. This is maybe the terminology. This is technique is called positive end respiratory pressure, PEEP. So this is PEEP. It's exactly like this. So in exhale we have to have a little resistance, a little pressure resistance. Finally, to finish my presentation, I want to say I really respect the doctors, nurses, the worker in the hospital, for they in front line of the fighting with virus. I respect their job, but by common sense, the better not to give them work, to give them a break, not to go there. And everything what I explain you, between just you have virus and you have to very exacerbation of your condition, if you will listen this presentation and use it, your possibility to not to go not to go to the hospital will be really, really high. And again, many people have a doubt about what I'm talking about. In our website, we have articles about this, and we have a lot of references about what I'm talking about. And finally, my presentation, it's not just only for information education. It not replace the doctor's visit, doctor's advice, or medical professional advice. This is only for information. In my last word, be healthy and safe.